Dr. Mohammed Gaballa and his research associate Nez spend hours each day in search of a medical miracle.
The truth is there is really no treatment as we speak for heart failure.
Dr. Gaballa wants to change that, and he thinks he's found a way to improve the quality of life for patients with heart disease.
So what we came up with here is that we figured out the heart have also cells. And what we're doing here is we are devise a method to isolate and expand these cells from a very small biopsies from the patient. We found that the cells can migrate and can incorporate into the myocardium, which is the heart muscle, and they can also repair the infarction. So we looked at the infarcted side or the scar size, and we can see that the scar size actually shrink.
The basic idea? Doctors can remove stem cells from a patient whose heart has been damaged by a heart attack. And this tissue can be grown and nurtured in a lab before being re-injected into the patient.
So here we're talking about a perfect match. We're also getting cells from the heart that are designed by nature or programmed by nature to read the heart. We're not trying to get cells from other organs and try to reprogram them to do something they are not meant to do.
The Sun Health Foundation has issued a $2 million grant to support the research and technique. Dr. Gaballa's procedure will then be tested on patients, pending an FDA approval of a clinical trial. Until then, he just marvels at the possibilities.
It's not local, it's going to be, and it's not international, it's going to be worldwide. It's, if it works, we have a tool in our arsenal to treat or to work with that. I mean, it's something that gives me a smile every day and keep me going, because if that really works the way in human as it did in the preclinical studies, that will give us option to treat these patients, which we have no option. So without that fund from Sun Health Foundation, I do not think this will ever made it to clinical trial. As simple as that, at least at this institute.